Hi, I'm Dr. Charles Galanis, a board-certified plastic surgeon in Beverly Hills, California. I wanted to take a minute to talk to you guys about high-definition liposuction. It's also called high-def lipo, 4D lipo, even Vaser lipo. There's a lot of different terms for it. So what is it? What are we talking about when we say high-def lipo? Essentially, it's a technique that tries to use a patient's own anatomy to yield very natural-looking and athletic results. Really what we want to do is create contours, but contours that look natural and not operated upon. It used to be with traditional lipo, you could debulk a patient, but it didn't leave the most natural looking results. A lot of times the results were flat. There weren't those shadows and peaks and valleys like what you want to see in a natural looking abdomen. So that's really what's behind high-def liposuction. Now, it's a technique that can be applied to patients of a wide range of starting points with a wide range of goals. It is not a one-size-fits-all operation. It was pioneered in South America a little over 10 years ago, but it's really exploding throughout the world as you can see results that far exceed what we were previously able to do with traditional liposuction. Today, I want to review some of the facets of high-def lipo. I want to talk to you about the tools that we use. I want to talk to you about recovery from the surgery, what you can expect in terms of results, and other aspects kind of associated with this technique. So I hope you guys find it informative. Let's get going. Well, the first step is the injection of Tumescent Solution. Now, this is nothing new. It's been around for decades. And basically, it's a solution of salt water, lidocaine, which offers some pain control, and epinephrine or adrenaline, which constricts blood vessels and therefore limits bruising. But what this fluid essentially does is it creates a space where the fat can be approached safely. That's step number one. Now, step number two is Vaser. Now, Vaser may sound like laser. It's not a laser. And Vaser itself is not liposuction. Vaser is an ultrasound device, and Vaser stands for Vibration Amplification Sound Energy Resonance. And what this ultrasound device does is it frees up fat from the neighboring structures, and it allows more efficient and aggressive fat removal in areas where we want to do it. It also doesn't damage neighboring structures or do that collateral damage, so there's less blood loss. Now, what's really important to know is just because someone has a Vaser device doesn't mean they know how to use it. There are nuances to the use of the Vaser device. That includes which kind of probes to use, which depth to use them at, and there are various settings, different power settings that are important. Another important facet of Vaser is that you can still use fat for grafting when using Vaser. A lot of people ask, well, if you use Vaser, are you melting the fat? You're not melting the fat, you're just freeing it up. So if you want to use it for fat grafting, you certainly can. So that's step number two, Vaser. Step number three is actually the liposuction itself. Now, in my practice, I use what's called power-assisted liposuction with a micro-air device. That's a vibrating cannula which helps to free up the fat while removing it through a metal straw. Now, just as with Vaser, there are nuances to how you do liposuction, and this comes from experience and training. And that includes what kind of cannulas you use, what thickness they are, what depth they are in the skin, and which access points you use to do your liposuction. So there's a lot of facets to it to deliver the optimum result. So that's step number three. The last step has to do with skin tightening, and in my practice I use Renuvion, formerly known as J-Plasma. This is a radiofrequency-based heat treatment which tightens skin from the undersurface. Now remember, when we do liposuction, we're clearing the fat out, but we're doing nothing for the skin above it. We're relying on the body to tighten the skin down. With Renuvion, we can jumpstart that process to really get that extra special skin tightening, especially in areas where we're trying to create contours. Okay, we've talked about the steps involved with high-def liposuction, but let's talk for a second on who's the ideal candidate, who's the ideal patient for it. Well, the ideal patient is someone who has a healthy weight, meaning a BMI of less than 32, no history of massive weight loss or weight gain, and really on exam has skin that's of good quality that will show a good ability to tighten down when the liposuction is done. Another way of thinking about it is we're looking for patients who lead a healthy lifestyle and have sort of maxed out what they can do with that healthy lifestyle and are looking for just that next bump to get to the next level. Now, although those are the general guidelines for patients that I use, there are a subset of patients who may not fit one or more of those criteria, but we can still use high-def or Vaser lipo at the same time as doing a procedure like a tummy tuck, which they may require. One of the more common questions we get is, can I get a Vaser liposuction or high-def liposuction for this area or that area? So I want to talk for a second on what areas we can apply this technology and technique to. Well, quite simply, it can be used just about all over the body. That does include the arms and shoulders, the chest in men, the abdomen, waist, and back in both men and women, the outer thighs, the inner thighs, and even in some cases down by the ankles and calves. Now, some areas we do not use it. Generally, I do not use it in the neck. I do not use it on the front or the back of the thighs. Those are areas which are more prone to complications when you try liposuction in general. The beauty of it is, in many situations, we can do multiple areas, including all the areas, in one operation. So it really depends on what the volume is that we're trying to take out, what the health of the patient is overall. But in some cases, multiple, if not all of these areas can be treated in one sitting. One of the things that separates high-def liposuction from more traditional liposuction is a post-op regimen that's a little bit more involved than what people may have been accustomed to. It used to be you'd get liposuction, people would throw on a garment and see it back in 3 months. Well, it's a little bit different now when we're doing a technique that's more involved, when we're trying to get results that are far more exceptional. So what is part of this post-operative protocol? Well, it includes a few things. Certainly compression garments are still a big part of what we do, and those are going to be required in most cases at least a month. In most cases in the abdomen, there will be drains that are left, and these drains are going to be in place for about 7 days for most patients. Lymphatic massage is a key component in the recovery from high-def liposuction. It's crucial to get a minimum of 5 sessions, and in many cases double that, to help remove the fluid, help with pain control, and get as smooth and excellent a result as possible. Lastly, there are some adjuvant treatments which we often recommend for some patients. These can include ultrasound or additional radiofrequency treatments once the patient is further out from surgery. I want to talk for a second about healthy lifestyle as it relates to high-def lipo, because high-def lipo is not intended to replace or excuse an unhealthy lifestyle. Really, they're meant to work in tandem. And in fact, the more a patient takes care of themselves, the better the result's going to be. You know, a healthy lifestyle is important to me. I'm a doctor, of course, so it's something I'd always want to promote. And it was important to me to be part of a technique that rewarded a healthy lifestyle and really helped patients who are living that healthy lifestyle get to the next level in terms of what they were seeing in the mirror. And those are really the perfect patients. So, you know, if you're looking at this procedure, you're really looking at it as just another thing to add to your armamentarium of that lifestyle, whether it's diet, exercise. This can be that thing that will get you to that next level that maybe you weren't able to get to before.